Michael, I saw a question here that you may be able to answer. It's from somebody named Michael as well. Further to the freezing and stability study issue, what are the shipping studies needed and what issues have been seen during transport?
I think the most common shipping issue and stability, regarding the stability study, that I would need Colleen or Catherine maybe to comment on specifically the studies that have been done. But usually the biggest issues we see in transport are, temp tail issues, like the temperature of the product not being tracked and recorded, usually due to a technological issue. It's not so much that there's an issue with the product, but just the technology sometimes will, as it always does, give out, and you may not know the temperature. So that's the most common that we've seen during transport. Of course, we've also seen issues with damaged product arriving on site. We've seen that in real world experiences too, where patients are waiting for a product, and when the product arrives, that it's damaged, whether there's a hole in a bag, whether it's not frozen properly, or from the time it's actually inspected to infusion, there may be an issue that comes up. Maybe it's not thawed properly. So there are a lot of nuances that occur from the shipping aspect that sometimes it's not always clear where the issue is occurring. And so, once that product is packaged and shipped, you may not know exactly what went wrong during that shipping. But those are some of the circumstances we see.
Got it. Thank you.
Yeah, I think the damage that you bring up is a real issue, right? Thankfully, knock on wood, we haven't seen that when we have transported our stem cell derived therapies. But as a physician, I have seen, this is why we generally do not start patients on their transplant regimen, so meaning their high dose chemo and radiation, until that unit is in at the center and has been inspected, because we have had, if they're not packaged right and they're bouncing around inside, they're broken basically, right? And you can't use it. So it is a real issue, but that's usually human error, right? Not packaged well.
Colleen, it reminds me that, many years ago, before, I think when cell therapies were a bit more naive, right? We were, patients were starting lymphodepletion before cells arrived on site. And we had a couple of circumstances where the product was damaged and the patient had already started lymphodepletion. And now this will be to your point, right? It was an autologous product. So we had to remanufacture. That was taking 6 to 8 weeks. That patient they didn't have that kind of time to wait. And, those are dire situations where the product is damaged, and whether it's at the CDMO or being shipped. But we learned that the hard way for sure, that at-risk lymphodepletion, it's a tough position to be in. But I think there are still companies that actually do that, even though it's fringe a bit, yeah.
Well, I think the other thing to think about with that is it's some indications, some things we treat may also be treated by the lymphodepleting chemo, right? That, like, it may be an appropriate drug to use, but in the situations where lymphodepleting chemo is given only to prepare the patient for the infusion of those cells, that's when the patient gets all the risk and no benefit, right? Yeah. And for me, really, those are the kinds of things that have been driving all the things why we're doing what we're doing and why we're trying to make the products we're trying to make.
Yeah.
To avoid that. So
yeah,